Viviscal commissioned me to carry out research into looking at the psychosocial consequences of hair loss and hair thinning, because while there is already some research out there, including the research that we've conducted in the past, it's still the case that we understand quite a lot about the physical consequences of hair loss, but we're not so knowledgeable about what happens to people psychologically. It is the only one I know of at this scale where there are 1,400 participants involved. We found that around 30% of people had hair problems. The majority of those are male or female pattern baldness, and around 2% of the overall sample experienced alopecia areata or totalis. We found around 20% of them felt that their identity had changed in some way, so their notion of self was different to how it was before they experienced the loss of hair. If people feel that their identity has changed, then that has a fundamental impact on how their relationships can continue and develop, because if they're a different person, how can their relationship with someone stay the same? People read a short paragraph about someone going for a job interview, and the difference was either that it was a man or a woman going for the job interview, and they either had hair thinning or they didn't have hair thinning. People with hair thinning are perceived as less attractive than people without hair thinning, I think is a significant finding, because we know that first impressions do count. We know from 40 years of psychological research that the way that someone is perceived at the first instance that you meet them has an impact on all future interactions with that person. So this was a job interview, an important, formal occasion, and the people with hair thinning were seen as less attractive. So that is going to have an impact on how they are seen to perform throughout the job interview. So I would suggest that is probably means that they would be less likely to be employed. A lot of the time when we're talking about the psychosocial problems people are having, we're talking about what people report. It's the self-report. It's, yes, I do feel anxious. Yes, I do feel depression. But there is some evidence that this anxiety, this depression, these problems can develop into significant psychological and psychiatric disorders. Many of the doctors and dermatologists don't take the psychosocial element particularly seriously. They look at someone with hair thinning and say, that's perfectly natural. That happens to all of us. Go home and don't worry about it. And that's quite a common attitude, that idea that it's just a minor skin complaint, it's a minor dermatological disorder. The findings from the study showed very clearly that it doesn't matter how long someone has had hair problems, it doesn't matter how old they are. We had people who were in their 80s, women in their 80s, describing hair thinning and saying that they still experience problems as a result of it. So it's got nothing to do with age, it's got nothing to do with how long you've had the problem. The main conclusion, I think, is that people with hair loss or hair thinning can experience significant psychological damage as a result of the problems that they have with their hair. We need to think about the way that doctors and dermatologists treat people who have problems relating to their hair. We need to actually not only provide people with appropriate treatment, but we need to provide them with appropriate psychological therapy where it's required. And I think it is required amongst a significant group of people. And that would help them, because we also know that hair loss it can be caused by stress. So if someone is stressed because of their hair loss, then if we remove the stress, then perhaps their hair will regrow. It is quite possible, it does happen. If we can get the findings out and say to people, look, it's quite normal to be distressed, it's quite normal to be afraid of going out, and then that, I think, is half the battle for people.